How are you? So lately we've been talking a lot about deadlifts and why you may have lower back pain when you're doing them. And you may even find that you want to steer clear of deadlifts simply because your lower back hurts. So in another video, I covered chest positioning and how that affects your spinal alignment, which is one reason why you may have some pain or discomfort doing a deadlift. Today I'm going to talk about core engagement. Now, as you can see, I am not wearing a shirt. You're not going to see this from me very often, but for educational purposes, here I am. And yes, I do talk with my hands a lot. So first, what I want to talk about is how the core muscles work and why they may not be working so well when you're doing your deadlift. So simply put, if your core or your abdominal muscles aren't activated, your lower back takes over. So if you're nice and relaxed, like me right now, and you're not exactly engaging your core, you may find most of the work coming from your lower back. You might have some from your glutes, your hamstrings, but chances are if you're feeling it in your lower back, there's something happening with the core, whether it's relaxed or you're only engaging the rectus muscles. There's something there. Okay, so first I'm going to demonstrate a deadlift with a relaxed belly. So again, this is my belly, nice and relaxed. It's not contracted. It's not doing much of anything. All right, got my barbell here. So this is going to be really hard, by the way. So I'm going to, belly, and then I lift. So instantly I'm feeling the work coming from my lower back here. So again, I feel it instantly in my lower back. I'm not feeling the work being balanced out in the core. So another possible reason is you're engaging your six-pack muscles, your rectus abdominis. Typically what happens here, so I will activate mine. So, and now I'm braced. You feel most of the work coming from the top of the abs. So the work isn't exactly being distributed throughout the transverse abdominis, helping out the lower back. So I'm going to now demonstrate what a deadlift looks like with just the rectus muscles engaged. So a cue that you might use is belly button to spine, and you might find again all of this working up here, which again your lower back is down here, right? So you don't have these muscles working for you to help you here. You've got these muscles kind of up here, right? So try that again. Brace. Again, I'm feeling that coming mostly from my lower back. And I'm finding it harder to breathe here as well, just because my diaphragm, which we'll get into a little bit more in a second, but my diaphragm is here, right? And with these muscles contracted, it's harder to breathe, which again makes it a little challenging to stabilize your lower back. Okay, so how we might help you with the core engagement and figuring that out is taking a look at the deep core systems. So this means, typically when we think of core, we think of the rectus or the six-pack muscles, which clearly I do not have, but we think of these muscles here, the top layer of your core or your abdominal muscles, right? But what we want to do is think about the deep core. The deep core is made up of four muscles. So we've got the diaphragm here, the pelvic floor, which these are opposing muscle groups or opposite muscle groups, and they work together. And then we have the TVA, which is like the corset abdominal muscle, kind of comes in and wraps around. And then the multifidus. So the multifidus is the muscle that runs up and down the spine. So as you can see, when we want to engage our core, if your lower back is hurting, we want the transverse abdominis, or the TVA, to work with the muscles in the lower back, the multifidus. To do that, we need to work this core 4, or this core as a system. So we'd start by just breathing. Inhale in, exhale. Inhale, so as you can see, my belly, my ribs. I'll show you from this side. Inhale, everything is nice and relaxed. As I exhale, my tummy here starts to contract a little. So now what we want to do is include the pelvic floor with a TVA engagement. So on the inhale, you're going to inhale in, like I said, everything is all relaxed. And then on the exhale, like you're blowing through a straw, you're going to lift your vagina muscles up and in and pull your hip bones into your belly button. So everything's expanding. Hip bones are into belly button. My pelvic floor is now up and in. I'll show you from the side. Inhale, exhale. Maybe I'll get my hands out of the way there. Right? So again, I can feel engagement through here. I can feel some of the work coming from my lower back. And everything is just all nice and stable. Okay? So now I'm going to put the pieces together with a deadlift. Move this over a little for you. Okay, so inhale. Okay, and now I'm going to do it. Okay, now I'm going to, everything's nice and open as I lift. On the exhale, hip bones into belly button. My vagina muscles are coming up and in. There. Now I feel the work coming from the core, or the deep core system, right? So I'm feeling a lot of stability from my TVA, which is helping out my lower back. So there you go, give it a try. My best suggestion is first practice. You can do this by laying on your side, making sure that you're neutral. You can also do this laying on your back with your feet flat on the floor. Give yourself a few minutes, master the breathing, and then give it a try with your deadlift. Let me know how it goes, guys. Thanks for watching.